Go ahead whenever. Hi, my name is Eric. I'm with Fleet Feet, and we are doing just a quick video on some tips on how to fit shoes, how to pick out shoes when you're somewhere where maybe the staff don't know how to kind of guide you, or there are no staff to guide you. So the first thing we want to talk about with shoes is the type of shoe that a doctor will typically tell you not to get will be something that can easily fold in half, at the middle, or that has no support in the back and it kind of just folds over when you push on it. Or if you twist it longitudinally, it is just extremely kind of thin and flexible. So you want your shoe to have a little bit of structure to it. Second, we got to talk about fit. This is something we see a lot at our store. First, you want to have between the tip of your toe and the end of the shoe somewhere between a half and a full thumb. So of space. That allows for swelling as you're on your feet throughout the day or exercising or what have you. Many people kind of get used to their tip of their toe at the end of the shoe, either because that's the way they've always done it, or their foot has grown throughout their life and this kind of happens slowly, and that can cause a lot of trouble. Second, in terms of fit, is the widest part of your foot. The widest part of your foot at the knuckle joint of the big toe and the little toe should not hang over the edge of the shoe. If they do, then you need a wider fit. Next, once you've got your fit nailed down, then we can talk about the foam, the underneath part. There's different ways that shoes are built. This shoe is flat in terms of the heel to the toe rise. It's completely flat. Whereas this shoe has a pitch. It's raised in the heel. You also will see differences between shoes in terms of less cushion and more cushion. If your foot is having zero pain or zero problems, then none of that really matters. Just try on shoes and go with what's comfortable. But if you're having some pain, then those things do become relevant. If the front of your foot hurts, then a shoe that is flatter in the heel, lower pitch, like this particular one, can take pressure off the front of the foot. A shoe with more cushion under the toe box can be very good for front of the foot pain. And then the last is a shoe with a wider fit in the front can take pressure off the front of the foot. Now, if you have, on the opposite side, if you have heel pain or arch pain, then a shoe with a more of a pitch, a higher pitch, is probably going to be a better bet for you. And or a shoe with more cushion is going to be good for that. If you happen to have, your feet are fine, but your knees are sore, your back is sore, then we're going back to that flatter pitch shoe, because that's going to help with that alignment, which is going to be good for the knees and the back. The last thing I want to say is, if you've never taken out the liner in a shoe before, these thin foamy liners are there because on the inside there's some seams where the shoe comes together, and that would give you a blister if you didn't have something in the way. So these are just intended to be a little kind of barrier from blisters. They're not intended to do a whole lot. If you have some like a tricky foot, high arch, very low arch, or you have some pain, you may find that an insole in there that replaces this with some extra support, contour to the height of your arch, can really improve the fit and improve some of those pain symptoms that you're having. So if you come to Fleet Feet, we have 3D foot scanner. We're happy to do that. It's free anytime. We can kind of give you some guidance, but if you don't have the opportunity to come visit us, then hopefully this video is going to help you get on your way. Thanks for watching.